editor, and really delighted to welcome you to our final day of Devex here at UNGA 78. And we're really excited to be hosting this event in partnership with World Food Program's United Nations Humanitarian Response Depot, where we're going to be looking at the role of partnerships and collaboration in responding to crises. The past couple of days, we've been hosting many events and discussions right here in this room where we've highlighted just what a dire situation we are when it comes to food, climate, geopolitical challenges. And, there's been a lot of maybe doom and gloom this week, but I think one area of hope is looking through the power of partnerships and collaboration. And we're going to do that in today's event and really shining a spotlight on the Initiate Squared program, which is a 5-year initiative co-managed by WFP and WHO that is looking to bring innovative solutions to health response that also could be applied to other areas. To kick us off, I would love to welcome to the stage Carmen Rabana de Lara, who is the director of the School Feeding Division at World Food Program. So Carmen, why don't you come up on stage? Thank you. So Carmen, you manage the School Feeding Program. And I imagine that requires a lot of collaboration and partnerships and being different groups together. Could you talk a little bit about the power of collaboration and partnerships and in doing what can often be really challenging, tricky, complex kinds of response?
Yeah, so is this working? Yes. First of all, thank you so much for inviting me. My colleagues in Rome, I hope, are watching, and I'm doing justice to their work. I'm our director of our school-based programs division in Rome. We look at everything that has to do with hunger in children in schools and how important that is that children are fed before we're asking them to learn. So the topic of today is really not my area of expertise in terms of logistics and emergency response, but what is this issue of partnership. So I'm hoping I can help to kick you off on a good start, particularly I've had the same experience this week of a lot of doom and gloom, a lot of conversations around how bad the situation is, both on the food system side, on the hunger crisis, on climate change, just a lot of very scary things. So from my experience, the problems are so big, the systems are very complex, and the challenges that we're trying to face are so difficult that it really will require and does require a partnership approach, and probably a different partnership approach. From my perspective and the work that we're doing in the World Food Program when it comes to nutrition, hunger in schools, it really has required a different kind of collaboration that is not just about connecting different partners, including different UN agencies, which is obviously needed, but also a focus on the field, a focus on what is really required by the people that we're trying to serve, by the countries and the governments that we're trying to support, and bringing them also at the center of the solutions and the center of the table. So some experiences that have worked really well in the context of school meals, in the context of what we now have, we call the School Meals Coalition, which is one of the most successful partnerships that are online right now, is the focus on one challenge, on a particular piece of the challenge, and because we can kind of get lost in the complexity of things if we try to kind of take a huge bite of the issue. So how can we focus on a complex but manageable piece of the challenge? How can then we get different actors that have complementary resources to bring to the table? So UN agencies together with research institutions, together with government leaders, together with implementers and organizations that are in the field. If you get all of them together in an initiative that then really importantly has some sort of coordination incentive, some sort of either anchor that helps to bring all of that together, then somehow you create a bit of an incubation mechanism to come up with new solutions.
Yeah, and I think that is what we're going to be looking at further in the program is how this Initiate Squared is a one of those taking, I guess, a bite of seeing how you can use the power of partnerships and collaboration to really move the needle in one specific area. So thank you for setting up the stage for us and framing the power and the importance of partnerships and collaboration. So thank you, Carmen. And
Thank you.
we will move now on to, I'd love to invite Mike Ryan to the stage, Executive Director for WHO Health Emergencies Program. Thank you, Mike, so much for joining. I know you've had here's a mic right behind you there, a very busy week. So I appreciate you taking the time to join us this morning. So I was earlier this week at CGI and heard Darren Walker, President Ford Foundation, say that our institutions and funding isn't set up the way people live. And you could maybe say that about a crisis context too. So we have institutions that are looking at specific areas, which probably makes sense from an institutional standpoint. But from a person experiencing a crisis, they're not experiencing them in silos, right? They're experiencing them all across. So I'd love to hear how this Initiate Squared program and the way you think about humanitarian response in your role at WHO in addressing all of these areas and how you use collaboration and partnership to be able to do so effectively.
$1 million question. First of all, just let me say for anyone here or out there from WFP rocks, and my heroes. And I think you wouldn't normally put the World Health Organization and the World Food Program together in terms of what we do is help people, but we do it in very different ways. WFP is very immediate, very much based on those food needs. It's brilliant at the logistics, brilliant at delivery, brilliant at getting things places in time. We've got the brains. WFP has got the brawn, no insult, right, in this space. So, and I think the real trick in humanitarian intervention, any intervention, when you have so many vertical pipes, is to take yourself out of your organization and put yourself in the place of the people, the person, or the community that you serve. So, I've spent my life on the front line of epidemics, in Ebola outbreaks, in other things. Imagine having to put on protective gear in 100 degrees with 100% humidity, go in and look like an astronaut sort of space suit on you, and you have a poor person behind white plastic who can't see their family, terrified, dying, alone. And the last thing they see is someone who looks like an alien. We saw that happen in COVID. That's been happening in Africa for decades of these big Ebola outbreaks. We were brought into that reality, that lived experience through COVID. No one in the West, no one in the world understood what it meant to die alone, looking at a faceless person. So when we had those experiences in Ebola in West Africa, we had those experiences in COVID, we've worked really closely with the World Food Program to say, look, we need to change the way we do this. And a lot of credit goes to people in MSF, in Alima and others who've experimented ways of making care more humane. I remember in the outbreak in Congo, a husband and wife, a doctor and a nurse being in 2 cubicles beside each other through white plastic, been able to talk to each other and talk to the family outside. The doctors and nurses in normal gear being able to look like human beings. The situation was so normal compared to my lived experience of big Ebola outbreaks, the horror of these treatment centers. So I think what we've managed to do with the Initiate project is say, we can bring technology to bear together. We can bring logistics to bear together. If we look at the lived experience of the patient, the lived experience of the doctor or the nurse, what can we do to make their lives better, to make their performance better, and make sure that we humanize what we do? It's very easy to count in numbers. I'm trained epidemiologist in public health. We're all epidemic curves. Everyone now knows what an epidemic curve is in the world. My mom talks to me about the reproductive number being very high today, you know.
You must have made her very proud.
Yes, well, I don't know. She tells me I'm a legend in my own lunchbox. I don't know what that means, but it brings me right back down to earth. No, but I think we see the world in numbers, and we do it ourselves. You do it in the media. I do lectures, we talk about N equals 1,000,000 people, or N equals 1,000,000,000 people. N equals 1. You start with 1, you help 1, then you help 1 more, that's 2. And if you keep your mind focused on that, and keep your organization focused on service, serving the people we serve them, they don't serve us, then we get rid of all this BS, the inter-organizational rivalries and who's the boss. You know, my 6-year-old daughter taught me that lesson at 6 years old when she looked up at me and said, you know, Dad, you're not the boss of me anymore, right? So there's too many people trying to be the boss, too many people trying to be visible, too many people trying to take the credit. A little bit of humility and a focus on excellence and partnership. And that's what we've done with the World Food Programme and 20 other partner organizations with Initiate.
So what would you say is the biggest challenge to actually, it's great to talk about that and then to actually have that happen in reality, and particularly if you're thinking about in a crisis context. Walk me through a crisis hits, you're thinking about your response. How do you go about that in an effective way? And what are some of the challenges that you experience? And what are some of the ways that you've, working with WFP, have found ways to get around it?
That's a great question. I think sometimes in the humanitarian space, we have and have had historically this idea of doing anything is better than doing nothing. It's a do-gooder approach to the world. Well, but the problem is the people in the situations we serve need the best. They need excellence. So I think the first thing we need to be doing more and more is structuring how we respond. We've had to do that in WHO. We've had to evolve from an organization of doctors we're trained to be arrogant. We're taking people's lives in our hands all the time. And there's a certain degree of ego and arrogance of knowing better than somebody else. And that brings a complacency, and that brings mediocrity. And you cannot be mediocre in a humanitarian situation. You've got to be fast, you've got to be effective, because people's lives are literally at stake. Literally, it's not next week, it's not next year. For WFP, it's today, because the kids will start dying tomorrow if you're not there. And it's bringing that sense of urgency, but calm urgency. You can be very urgent, but you don't have to be chaotic. Urgency does not require chaos. Urgency requires calm under pressure. And that's where the planning comes in. We see it in sport. It's when you kick into that muscle memory. If you've done it and practiced it and you've gone through it, then what happens in the crisis is once you've done it enough times and you have enough planning done, it becomes more automatic. And I think that's where we have to learn. Humanitarian response is a high performance pursuit. And it requires high performance and practice and exercises and a lot of self-analysis and actually being able to identify what you're not doing right and being open to that and not accepting, well, we're here to do good, so it's okay if we make mistakes. No, it's not. No, it's not. So that's for me is the most important aspect, is that urgency without chaos.
And so there, I'm sure you've been very busy this week with various high-level meetings and on pandemic preparedness. Take us into some of those conversations and how collaboration partnership is shaping how you're looking at approaching pandemic preparedness, and maybe using your experience with WFP as a model for how others can try to do the same.
I think we're living less and less in a world where we've got these hierarchies, where everything can be planned out in a nice structure. You know, we love organograms. You know, everyone wants to find out, where am I? You know, I think we're living much more in an ecosystem of enterprises, and that can be a new information ecosystem, an innovation ecosystem, communications ecosystem, a logistics ecosystem. And it's about recognizing who you need in the different pieces of that, right? It's much more organic. You can't completely predefine what you're going to need, neither can you completely redefine who's going to be important or who's going to be crucial in the process. So can you create inclusive partnerships that allow that partnership contribution? Can you build from the bottom up? Because we don't often, like, I'll give you one example. We do work now on integrated outbreak analytics. And for the first time with UNICEF and others and Red Cross, we're actually analyzing the epidemiologic information in the field with communities, with the social information. So instead of waiting 4 weeks to work out why people are resisting contact tracing or resisting the vaccine, well, ask the people. They're there. And that's what making those connections lower down in the system and seeing the community as the leaders of the process and going beyond. Sometimes we talk about communications, and that means buying more loudhailers and buying more posters. That's not communication and engagement. The communities very often, in my experience, have the answers. We just don't ask them, or we don't listen when they tell us. So we have a lot to learn in that space. One story about working together and trust and collaboration. On January 30th, 2020, Dr. Tedros declared a public health emergency of international concern. Very, very quickly, logistics, supply chains started to shut down. There was huge stress. I remember speaking to our colleagues, WFP, Amr, Dawidi. We knew we were under geared to do this. I think on the Friday or the Saturday, we talked about some people coming up from Rome to work with WHO. On Monday morning, 50 people showed up in Geneva. WFP, bags. What do we do? Where do we go? Right? I will never forget that, and our staff will never forget it. And for the next 2 or 3 months, it was WFP staff who worked on the UN COVID supply chain mechanism with other partners at the Clinton Health Initiative and others. But WFP were the core of that. So I know we're going to finish, so I just want to recognize that the work that WFP do around the world, it's a huge honor for us as WHO to work with them, to work together on bringing better solutions. And I have to say it personally, because I've been at the front line. I've worked in the clinical setting. I've buried the bodies. I've worked with the communities. The Initiate project is really trying to bring solutions that work for people where they are, not where we are.
And the Initiate project is about at its halfway mark. What would you say could be lessons learned for replicating and scaling that? It's interesting to hear what you're saying. A lot of the success of this sounds like it's more of a culture, right? Losing your ego, facing with humility, using a user-centered approach. How could you maybe take some of that and scale it to other aspects of humanitarian response? And what are you hoping that you can do with this project moving forward?
Well, I think that's actually happening with the UN cluster-based system of bringing agencies together around logistics, around health, around protection, and I think that has really helped. The fact is, the problem is getting bigger. We're now 400 million people on this planet in acute need of humanitarian assistance, and that number is growing by the month. I have to check the number every day because it's just exponentially getting out of control. The financial space for humanitarian response is contracting. Everyone, WFP, UNHRD, look at the Red Cross movement. The ICRC has been around for more than 100 years. It has been absolutely at the center of protection and civil human rights for more than a century and a half at this point. And it's struggling with its finances. I couldn't believe it. The world cannot give enough money to the Red Cross to do what it does. So I think in a space where the money is disappearing, where the need is actually growing, that's going to require us to be more efficient, to work together more, to reduce the waste in the system, and to make sure that every dollar counts, and make sure that everything we do matters, because it's not going to get any easier. It's going to get harder. But, you know, the people who work in this space are incredible, because they're some of the happiest people I know doing some of the awfulest work that needs to be done. And I think that's because people serve, and because the reward they get is not the promotion. It's not where they are in the organogram. The reward they get is a smiling face of someone they help on the front line. The gratitude, the unsaid thanks. I think that's what we have to focus on. We have to focus on, you know, humanitarianism. It's got human in it, right? It's that idea that, for me, N equals 1. It's the next person you meet. Don't worry about helping the 10,000 over there. Help the one here, and just keep adding. Yeah. And we eventually get there.
So in our final moment here, what advice do you have for those humanitarians, people in the room? I think and I was talking to a few of the folks before we started, have a pretty diverse group of professionals here coming from different contexts, backgrounds. What advice, and we also have an online audience joining us. What advice do you have for them in thinking about how collaboration can make them more effective and impactful in their work?
I think collaboration is fun. It gets you out of the space. I mean, God knows WHO is great to work with, but you get sick of looking at doctors and nurses and meeting architects and meeting engineers who've got ideas. Look at oxygen in the COVID response. How many lives did oxygen save? Hundreds of thousands. That's not because of the doctors or the nurses. That's because of the medical engineers who went out and set up oxygen plants. We often have this club idea, well, are you a humanitarian? Are you really a humanitarian? You almost get that question, or are you involved in a medical response? Are you a doctor? Are you a nurse? But to see architects in real time redesigning hospitals all over the world and seeing plans come in for hospitals in many developed countries, where in Italy, northern Italy, hospital managers with these huge hospitals, thousands of patients arriving, they didn't really know how to reorganize the hospital. And to see architects going into humanitarian mode, staying up all night, redesigning the triage in the hospital and sending back the CAD plans to the hospital manager saying, do it this way. I never thought you'd see an architect doing that in a frontline work. So I think that for me is everyone contributes, from the community all the way to the top. It's a community we have, of a community of practice. And it's leaving aside your preformed ideas of who's important in emergency response. Because I found in my life, working in the front line of emergency response, if you don't get the logistics right, and in our group, they're the least visible, but they move the system, they create safety for us, they make our lives livable in the front line. No one ever stops to thank them. Nobody ever stops to thank them. And WFP is the archetypical service platform. I don't know how many people here take flights in humanitarian situations and realize you're flying on Air WFP, So I think that idea, honestly, is just one of just recognizing how much people in other spaces have to contribute to what you're doing, and just being open to that idea and not getting locked in to any particular way or ideology of humanitarian response, or an ideology of excellence that says we're brilliant, we're excellent because, and everyone else has to prove themselves to us. It's a much more inclusive way of looking at humanitarianism.
Right. Well, Mike Ryan, thank you so much for sharing your time with us today. Thank you. I'd now like to welcome to the stage my colleague, senior reporter Stephanie Beasley.
Thanks, Kate. So I'll be leading this conversation on how to coordinate amid multiple crises in the world. Joining me is Raisa Banfield, an architect and environmental specialist, Director of Sustainable Development at the Center for the Integration of Nature, Cities, and Executive President of Fundación Panamá Sostenible. Also, we have Afshan Khan, Coordinator of Scaling Up Nutrition, Walid Ibrahim, Network Coordinator of WFP Managed United Nations Humanitarian Response Depot, who will be joining us virtually, and Alex Peterson Swane, CEO of Global Innovation Fund. Thank you all so much for being here. So I'd like to just start, before we get started actually, to say that I would like this to be an engaging, interactive conversation, and we're also going to have a Q&A for you all, so be thinking of your questions now. Hopefully we'll have enough time to get to as many as possible. So I wanted to start, we just heard Dr. Ryan talk about what he thought was necessary or important when coordinating efforts amid multiple crises and global threats. And I wanted to start by asking each of you what you think is important when you're trying to coordinate efforts and face things like climate change, food insecurity, conflict. And I'll start with you, Raisa.
Thank you. I love what Michael said about humility and less ego. And Michael, I would like to be in the front line because I am an architect. So we need a lot of knowledge, a lot of good willing, but we need to understand it's not one moment or one event to take a picture and go on. It's a process. And that's the difficult part because we start a lot of things, collaborating, supporting each other. But when the crisis is getting harder, everybody's gone. And that's our problem. And the other problem is money because everybody's looking for economical support to attend crisis, but the process needs sustainability, not just the fee for a moment, the diagnosis. We are plenty of diagnoses, and the communities are very tired to hear the problem. They need the solution, and this solution needs our support sustainably. So I think this is the huge challenge.
Thank you. I think when I look at Sun and having just joined the movement 100 days ago, I would really say when it started in 2010, the Scaling Up Nutrition movement was focused on this idea of partnership well before SDG 17. And that was bringing together UN agencies, civil society, the private sector and business, academia, with government in the lead to help define what the needs were to address malnutrition in all its forms. And that was either at the national level, brought down to the regional level, and working alongside local communities. And I do want to pick up something Mike said. That engagement with local communities, whether it's in a humanitarian context or whether it's in a development context, or whether it's in a hybrid where you have both, is extremely important in terms of what to engage on, who to engage with, and how to make the change that's needed. So I think the more we focus on that localization agenda, looking very closely at what are the community needs and building our response around that, we'll have far better success. So for me, aligning behind these nationally developed plans that are multi-stakeholder is a way to really build the momentum around partnership. And as was said earlier, in a consistent way. Sun has been around since 2010, and part of that is due to the commitment at the country level by national stakeholders on making sure that we can try and address malnutrition.
Thank you very much. To take a little bit of a different tack on this, I'm not with the Global Innovation Fund is relatively a sort of a generalist investment vehicle with the mission to accelerate innovation through both grant making, but also debt and equity investing. And we're backed by a series of bilateral aid agencies launched by the US and the UK, since joined by Australia, Canada. And I say all of that to say that I actually think that this kind of pooling of capital is really critical for collaboration. And why is that? I mean, it's because as we all advance to solve challenges together in multi-stakeholder ways, we need to communicate, and especially about who can bear what kind of risk and how we can be creative about mitigating those risks. So think about the Global Innovation Fund. We're investing in innovation. And so by definition, some of the things that we do, they're going to fail. Failure is very difficult to tolerate from within aid agencies. It's taxpayers' money, after all, that's being deployed. So by using a vehicle like GIF to take on risks, the aid agencies reduce their own exposure. So money is pooled. So if something does fail, one agency only takes a bit of that loss. We are independent in the decision making that we do, so that if there is any sort of publicity, et cetera, it's at arm's length from the aid agencies. we generate returns when we exit from deals that we make. So we're building up capital at GIF that doesn't belong to any of the donors. And so that's stuff we can use for perhaps the most risky things that we want to do. And then we're also really committed to evidence. And I know that may not be obvious, but evidence generation of impact is a great way to mitigate risk. I'll give just one story I think is really illustrative of this. When Theresa May was the Prime Minister in the UK, in quick succession, there were two stories that sort of hit the tabloids about how was aid money being deployed. And the first of these, some of you may remember, the poor Ethiopian Spice Girls, which was a very probably quite sensible behavior change campaign being run in Ethiopia with some local pop stars. But, you know, the Daily Mail seized on that as an example of a waste of money. The UK government dropped out like a hot potato and walked away from that, and that program was canceled. Shortly after that, there's a story on the front page of the Daily Mail about cash transfers, unconditional cash transfers being done in Pakistan after a natural disaster there. The UK government, and I think Theresa May herself, came out and said, this is a very sensible program. This is backed by rigorous evidence. This is value for money, and we are really sticking with it. And it's a great example of evidence generation as a risk mitigation strategy that I think we can all sort of collectively learn some interesting lessons from.
Walid, I wonder if you have some thoughts to share on that. And I was particularly interested, I know Alex mentioned cash transfers, and I know that's something that the World Food Program and other agencies have also been looking into. But what are your thoughts on ways to better ensure coordination?
Well, and good morning, everyone. I think, well, most of the panelists have covered one, more of the pillars of what is necessary to do our job better. But I think it's important to speak about the preparedness phase. I mean, we very too often tend to try and come up with solutions when we're actually responding to an emergency. In reality, we really have to take the time to go through these thinking processes to come up with new solutions when we are in the preparedness phase. This is where we are more lucid, and we are able to draw on each other's expertise to really come up with something that can be sustainable. You mentioned cash. This is something that WFP is doing more and more today. It's almost half of our food transfers today are done in the form of cash. And we've learned during the years, and we now have developed mechanisms that can be activated, prepared and activated, but in remote, with pre-agreements that can be actioned right away when an emergency strikes. So we have partnered with the likes of Western Union, who have the ability and the presence in certain contexts to really switch on right away that type of assistance that we need to then pass on to our beneficiaries and affected populations. So it's really a multitude of things, as probably the rest of the panelists were alluding to. There's no one sort of key that can open all doors. It's really a cohorted effort on a number of dimensions. And again, as I said before, best if those are looked at times of peace, let's say, and not when we are in the middle of the storm.
I wanted to follow up on something Afshan said. You were talking about the role of local communities and local engagement. And I know, Risha, that you work, of course, at the local level. And I wonder, for you as both an architect and environmental activist, are there examples of things that you have seen that worked really well in terms of coordinating and collaborating with agencies that maybe their folks are coming from abroad, they maybe aren't as in tune with what's happening within those local communities? What has been helpful?
Yes, I have the privilege to work for the city as a deputy mayor in one term, last 2014, 2019, and we have a huge problem with floods. And nobody wanted to look at the root of the problem, because every sector to fail each other of the problem. So we start to create communication with the community, with the entrepreneurs, with the NGOs, and we receive the support of the in the international level from Holland, for example. They have 800 years working with the water. So working together with the external knowledge, but the local knowledge too, we build the solution and start to put it on for the community. And the community feel that lake were included with the ideas, the knowledge, not just with the guilty to do something bad. We need more than of those examples because we are more connected than ever. Climate change is a real thing and is for everybody the same problem. But we are trying to, okay, the developer countries has to pay more or has to do more. Everybody has to do something because we are in huge trouble and we are working so isolated. And it's the main risk, main challenge we have as a society. We have to change the indicators. We continue working with the indicators of the past century of wellness, of growth economy. We need indicators of biodiversity, of coffee, of water, of food, and work together with the knowledge of UN, but with the knowledge of community, with the architects, with the economists, with everybody. We have examples in all the world, but we are saying something and doing different. And this is a huge problem, but we can solve it.
Afshan, I wanted to ask you, you mentioned that SUN was created in 2010 and you're a multi-stakeholder, multi-sectoral group. And I wonder if you could talk about some of the lessons learned. Raisha has just talked about, how to engage with the local community. What are some things that you all have learned in that time that have been helpful in forming better partnerships?
So thanks so much for that question. And I think it's a very important one. And following up on Raisa's point, part of what SUN has been able to do is build up knowledge of what works. And that peer-to-peer exchange between countries is a really important component of the movement as a whole. So I'll give a practical example. In Ethiopia, the Sequoia Declaration focused on looking at specific aspects of malnutrition across sectors, right? So in the availability of food and nutritious quality food, in the health sector, in the sector of social protection, and in an integrated manner, brought that together to impact nutritional outcomes. That declaration and the work that was done at a multi-sectoral level in different districts and provinces was then shared with other countries. So for example, Uganda visited, Zambia has had an exchange, and we've been able to develop those peer-to-peer networks, learning what's worked, what hasn't worked, amongst different sectoral stakeholders, to then be adapted to country and local realities. So I do think that peer-to-peer exchange is incredibly important for learning and building knowledge networks between countries. The second aspect I would raise is really around the financing modalities. Many governments have raised with me that the biggest problem they have is effective financing. And you talked about it when you spoke about de-risking investments. The real use of how domestic budgets are better used in a constrained funding environment is going to be critical. So one, how do we better tag what's being used nationally? Tanzania has developed a Y budget, it's called. It tracks all of the investments in nutrition across sectors. The importance of doing that is to aggregate very clearly what the domestic sector contributes, whether it's agriculture, whether it's health, whether it's social protection, whether it's education, like school feeding, or water and sanitation. The ability to then track that at a domestic level, you can go to ODA partners and say, look, this is what we're funding, how we're funding it, and this is where our financing gap is. Development partners, the donor network that's part of the country level SUN movement, can then say, all right, this is what we're financing in our projects. And if that's on budget and appropriately mapped, you can then get to Where are the larger financing gaps? And who are some of the external partners around innovative financing, blended financing that can come in to support those gaps? So I think the architecture of collaboration is the basis for working together and is the basis for financing together this global agenda for malnutrition. And I want to agree with Raisa. It's not what is only in developing countries, to use the old parlance, let's say global north, global south. Malnutrition in all its forms now, whether it's undernutrition or overweight and obesity, affects every country across the globe. So SUN has evolved. Our newest members are mainly in Central America and Latin America. And the principal reason they're joining us is to share experiences around how to tackle overweight and obesity.
So I wanted to ask both Walid and Alex, we've talked a bit about how to sort of engage across sectors, but I imagine that though we have outlined some steps, this is still very challenging, especially during a humanitarian crisis, something immediate like an earthquake or flooding where fast action is needed. So I wonder if you can kind of talk about how you can sort of break down those silos and how you can foster better communication and faster action in these types of scenarios. What have you found to be helpful? I'll start with you, Walid.
Oh, with me, okay. Well, to me, the key, Stephanie, is really to create safe places for the humanitarian community to come around and express their different perspectives without the threat of being judged. We have heard from the other panelists some of these examples, and I think UNHRD in its history has been such of a safe place for the humanitarian community in the past. Now, both Raisa and Dr. Khan and Mike himself have alluded to the need of including the local communities and the first-line responders. As we create those partnerships, we need to ensure that a holistic partnership approach is followed, that we include, the partners that are required to sit on the table. But within this partnership, I think it's key that the local communities and the local responders are sitting at the table at the very start of any collaborative initiatives. We cannot afford to miss their insights and only bring them in sometimes as, tick off the box type of exercise. They need to be there because they are the best one and the best equipped to articulate to us what are the needs on the ground. I also wanted to perhaps, and again, some of you alluded to this element, a bit of an emotional trait that for me it's important behind any act of collaboration, which has to do with to me, behind any action of collaboration, there's an act of courage and an act of maturity. There are a lot of egos at play. Even if we are in the humanitarian world, the world competition applies also to us in some ways. We spoke about a restricted financial crunch where there are more needs and less resources. So we do get into this competition realm as well. And it's really important for us to let aside our egos. And because behind that act of acknowledgement that you cannot do it alone and you need someone else to lean on to solve your problem, that in itself is an act of courage to me. So both the maturity of organizations to understand and let aside their egos and that act of courage of acknowledging the need of help are key to any collaboration, successful collaborations, exercises.
I think it's such an interesting point about the humility of collaboration. And, to be clear, the Global Innovation Fund is not well positioned to respond to disaster. And I think it's much more, as you said, when you're more lucid in that preparedness phase, I do think that's where entities like the Global Innovation Fund can be useful. And there, I think what I'm like most about how the GIF model has been deployed is in thinking about how to build state capacity for response. And so that's allowed us to work on domestic resource mobilization, supporting nudge units to develop within local country governments, Bangladesh being the strongest example of that, using mobile phone data to figure out how to target cash transfers more effectively to the most vulnerable and most marginalized communities in collaboration between both Bangladeshi economists and the Bangladeshi government, and larger work on helping targeting and nudges within social protection programs across Africa, where the World Bank's very involved in implementation, but doesn't necessarily have the space and the mandate for experimentation. So there, I think, you're absolutely right. It's everybody coming together with humility. GIF saying, we don't have a lot of money, and when something really bad happens and you have an acute crisis, we're not useful, but we can be useful in this way now. And people within government saying, yeah, we want to build up our capacity around the use of nudges in social protection programs. It's everybody saying, we have a place to play, but we're stronger together if we work in that way.
So I wanted to come back to you, Risa, and ask you really quickly. We talked a little bit about what you think people should be doing to kind of foster better engagement with the local community. And I wondered if you could talk about how, people within like the activist and environmental community have found some of these partnerships. Like, how do you think that those partnerships can work better for you all? And like, what are some things that, maybe you can learn from, I guess, some of these agencies as well about how to work better on the ground level?
Working with the agencies, you said?
Yes.
Yes, the agencies are so important because give us the legitimacy and the knowledge, the stability, and the possibility of continue, because the agencies are stable. Sorry, because my Spanglish, and they can keep continuing the work even the government change. But we need to understand community, their cultures and environments. So many times the people from outside came to our places with all the problems solved. Coming there, starting to understand the situation, you can start to solve the problem with your knowledge, but mostly with the knowledge of the community and the environment. The environment is very important. For example, Panama is in the middle of the natural corridor biological. So if we understand this condition, the solutions, the investment, the finance is different from Chile or from Spain. No, we can solve the problems with the same manual for everybody.
So I think we have enough time for some questions. So if there's anyone from the audience who wanted to ask one of our panelists a question about how to coordinate and collaborate better, any hands? Thank you, sir.
Thank you. I'm Bob Castro. I'm here today on behalf of the NASA-funded Translational Research Institute for Space Health, which is making a global commitment to food and health and trying to get things to the underserved around the planet. I'm on the steering committee of something called the Nourish Movement, of which Dorit Donovan, the director of NASA Trish at Baylor, is joining. We've been, over the last 4 years, trying to do innovation across the sectors, ag, food, nutrition, and health. We found on the corporate side, as well as some of the UN agencies and other programs, an open innovation platform where people are willing to collaborate and cooperate, set aside some egos, but obviously they're trying to seek value. And we have NGOs and target populations. As we build out this coalition, what advice do each of you have for us to make it more effective across the multilateral sectors, the international organization sectors? Because a lot of these company heads are motivated, I think, by good social justice intentions. But at the same time, many of them have not worked in this arena before. So that's partially why we're here at Devex and Concordia and all the other things going on this week, to get some learning before we do the next grand challenge, which will actually be about $500,000 of NASA funds to take things that are designed for health and bring them here for as a food challenge. I'm calling it the next generation Tang, for those of us who are old enough to remember the powdered drink that came out of the previous space age. So please give us some tangible things that we can do to make this a more effective cross-sectoral collaboration, please.
Sure.
So let me maybe start. I think first of all, the more we can bring together health, food, nutritional outcomes, I think it's going to be key. You know, we've heard a lot of doom and gloom, but there's actually some good stories out there, right? We've seen a 60% decline in the number of children that were stunted globally. And that's largely because people have been able to bring together innovation over the last 20 years, innovation, technology, science. But the most important component, and I think it's what Raisa spoke to, it's how do you embed that locally? So the one thing I would say, as you look at these innovative platforms with many other partners, ground them in country realities, because the cookie cutter approach will not work. And even within countries, there's differences. But I think what there is opportunities to do, and we've seen this with cell phone technology and digital mapping. We've seen this with new products like small quantity lipid-based supplements that can help address malnutrition for kids 6 to 23 months or support pregnant and lactating women. But that innovation and the capacity to work alongside people to use that product in a good way depends on embedding in local actions and local systems. So just to say, maybe before you go all out, work alongside national actors to identify proof of concept before you go to scale.
I would like to add an example from our original people. They told me, before the West people came to us, we ate plátanos, we ate from the rainforest, we ate everything, and we ate good. Now, when the West people came, now we have to buy. They have to sell to us, and we don't have money to buy that. And they are now malnutrition. That's the problem, the way of thinking of us to impose to them.
Alex, did you have anything you wanted to add?
Oh, much more prosaically, I guess I would say really think about your governance structure and like a mixture of people who have financial skin in the game and people who don't have financial skin in the game, but who have sort of independent expertise, and have a mixture of those voices, both at the investment committee level and at your sort of higher governance level. I think that's really important to continue to keep a sort of shared buy-in, but also the clarity that comes a bit from being arm's length.
So I think we're going to take one more question, and I'm going to give Waleed an opportunity to answer both the last question and this question first. So if we have one more question in the audience.
Waleed is in minority.
Waleed is listening. Yeah. I'm really sorry not to be there with you. I'm missing a lot of fun, I guess.
You are.
Hi, I think I had the last question, so thank you so much for that. My name is Shayla Maniam. I'm currently at BCW, which is a firm that works with a number of private sector partners on issues like sustainability, women's health, food security, and things like that. We really believe in bringing the corporate element into making this a true partnership to address some of the world's greatest goals. Before that, I was with the State Department, so I have some field work here. And one thing I wanted to just sort of ask everybody, maybe especially Waleed, is how you guys are bringing gender into this equation. We know that women are the foundations of societies and economies everywhere. They are the pillars of stability. When we help women, women help the world around them. And this is something that we're working with a number of our corporate clients on issues like women's health and others. So I'd love to hear from you how you're addressing this issue of gender outside of maternal and child health.
So maybe I start with the first question, Stephanie?
Sure, or you can start with that one and get around to the second, whichever way you want to do it.
So for me, just the very act of, showing up to the table and offering help is largely, cuts it for when it comes to the private sector. It's really, I would say the ball is really in our court. we have to create, as I was saying before, those safe environments and ensure that diverse expertise and capability to be brought into those safe environments and ensure that we can benefit from the expertise that you bring. So maybe in a simplistic way, I think that from the private sector point of view, just being willing to engage is already a lot. It's really up to us to frame how that engagement can be put at use and in that constructive environment where we can benefit from each other's expertise. Now, on the issue of gender, the WFP has been looking at gender for many years, and gender now is embedded in our policies and programmatic activities. From really a UNHRD perspective, I think when we speak about the need to have a diversified expertise and the need of hearing the different perspectives, the powerful role that the gender component plays is priceless. I'll give you an example, really much linked to Initiate. As we brought in the local communities to be part of the Initiate project since the very early days, one of the comments that came from the communities, and especially women, was the fact that when we showed up into those pandemic settings and we put up those hospital structures, it was really hard for the communities to understand what was happening in there. I think also Dr. Ryan referred marginally to this in his intervention. What we heard from the families and the women as part of what the local communities brought to the table as we were trying to shape the structure of the infectious disease treatment center that we are prototyping through Initiate, was the need to see what was happening inside. The community always saw those structures are structures where people would go in and die. They couldn't see that there were actually a pool of doctors trying to save their loved ones. They simply didn't see what was happening. So for them, those structures brought by the white men, if you wish, were structures that a design process of Initiate, benefiting from that intervention and support and ideas from the local communities and their feedback. We were able to create a transparent solution where the community from the outside could see what was happening inside. And that meant, creating trust, so that they would essentially see that actually there was an effort to save lives and that was not a place where people would go and die.
Thank you all so much. I wish we had more time, and thank you all for your questions. It's been so great to speak with you today about this.
Thank you so much.
And now I'll hand it back to Kate.
Thank you, Stephanie. Well, in closing, I would love to welcome Thomas Tyka to the stage for CEO Direct Relief. Thomas, are you here? Hey, Thomas. Stand, sit, do you have a preference? Great. Well, it was a really fascinating conversation today. You're CEO of Direct Relief, where obviously you work a lot on mobilizing response in humanitarian context. What are your thoughts and takeaways from some of the discussions you ever heard?
Well, thank you first for having me, and it's quite an honor to be welcomed by the Nobel Peace Prize winning World Food Program. I think anyone else who wins the Nobel Peace Prize, that should be the first thing. Hi, we won that. But anyway, congratulations. It's quite an honor, and we're big fans too at Direct Relief. But the best and worst part about being the wrap up is like, I agree with everything that's been said, and I can't say it any better, but I'll do my best. But I do think a lot of the themes that came through, you know, we talk a lot about sectors, but I think I have it right that every human being is a member of every sector. So we're kind of this weird, what sector are you in? It's like, I think we're all in every sector. We're both private and public and social and health, environment. So I think that dilemma of focus, it's important to focus on the thing you're focused on, but it does come at the expense of something else. And we've heard repeated examples of that. So then you get into the, well, we need to coordinate. Well, everyone's for coordination, but they don't like to be coordinated, in my experience, right? So I think it's something that's easy to say we should all collaborate, but who's the team captain here? You know what I mean? So I think that collaboration does arise, and people have mentioned to that. Direct Leaf's always been a support organization. So I work in a warehouse. It's a nice warehouse, and it's in Santa Barbara, which is a nice place. But from that warehouse, I think because we are both privately funded as a public charity, our view is that just you got to invite the participation of everybody. No one with a job or a humanitarian label or in government cares more about the society than anyone else. I think that it can lend itself to almost a sense of superiority, and that's really damaging. Particularly, we have more money in the world. The world economy is growing, so the fact that less money is available for these things doesn't mean that less resources are available. We throw away 40% at least of the food that we produce in this country. So we have a distribution issue. We don't have a production issue. So the mechanisms, and much of this, I think, has come from the private sector, the scale and pace of innovation. And the blurring of what sector is which, I think, has a great application for the things we're talking about. I mean, tech companies are now media companies, which are producing the content that we're all watching. Is it a movie company or is it a tech? You know, who knows and who cares? I think sometimes the pace of innovation that exists in the world. I'm actually both really sobered and quite optimistic because I see the improvements that occur in our everyday life and how scary, how fast technology can pervade and dominate our lives. But I think that we have more resources and more tools today to solve all these vexing problems than we have ever had in the history of humanity, right? So that gives me great hope. The challenge is, will they be applied thoughtfully? Will they be applied fairly with the lens of equity? That's the dilemma I think that capitalism provides, because it's at the end of the day, capitalism works. It focuses resources, it drives competition, it brings quality up and costs down. But it has a very hard edge. At the end of the day, if you're in business, there's one question: if it's going well or not, did you make money? And there's just a lot of stuff in life that we're talking about that is inherently valuable. We knew in the second grade, but it won't make money. What's the business plan to make money from taking care of a kid with disabilities who's going to need lifelong support? We're smart as people. We just need to kind of reframe some of these things. And I think that is done by just inviting the participation of everybody who's got a stake in it. I also think that I love that architects are not going to take over the world, because I mean, you think back to 2010, in a short period of time, you had two massive earthquakes, one in Haiti and one in Chile. One killed 230,000 people. And a bigger one in Chile, they lost about 500 lives. And that was based on building codes and resiliency. I don't know if it was preparedness or resiliency or community planning, but it was definitely architecture and those thoughts of resiliency in a broad sense. So I think we've learned a lot of this stuff, and I think that it's incumbent upon those of us who step in to try to deal with it to recognize with a much wider lens all these issues and who has something to offer, whether it's NASA or the tech companies. We are entirely privately funded. And although it's a warehouse, through that warehouse, it's been $1 billion of aid flow just to Ukraine in the last 18 months. And that is because we invited the participation of medical manufacturers who recognize this is a crisis. They're not going to make money in the near term, but they have resources that they can produce at scale and low marginal cost, and they wanted to make that available. That was a much easier thing for them to do than say, you're a big company, give money to a different organization, because the challenge with money as a measure is that money is only good to purchase goods and services with. It has no inherent value. Its value is realized in what it's exchanged for. So if you say, I need more money, I have 4 kids. Yeah, everyone needs more. Well, what do you want? What are you going to exchange that for? So I think to invite those things that have inherent value, those who manufacture, those who understand, those who manage information well, they're doing it every day. And so I think the hopeful message is that the inviting of their participation in a thoughtful way without suspending the near-term profit motivation, you can unlock a lot of value, including, in our experience, what we can do to help millions of people have access to an essential medication they would not otherwise get through any other means. And that's really tapping into the vibrancy of the people who are not often included or wear the humanitarian or NGO or humanitarian badge, but the skills, the things they know how to do are absolutely essential to performing these functions for humanitarian purposes. So that was a very long-winded answer. I apologize. I've forgotten what the question was, but it was a really impressive group to follow, and thank you.
It was, no, and I think a common theme through all these conversations is that these really complex challenges require everyone coming together, but with humility, throwing out the ego. So I think that was a really great note to end on. So thank you, Thomas. And thank you to everyone for participating in today's event. Also, thank you to World Food Programs, United Nations Humanitarian Response Depot. We really appreciate partnering with you on this. Please do stay tuned. We have another event starting in about an hour with WFP US to explore power, purpose, and promise of corporate engagement to tackling global hunger. So we'll be delving into some of these themes as well. And then at noon, we will have a lunch. And then at 1, we'll be kicking off our news programming as part of our summit this afternoon. We have a really exciting lineup. So feel free to stick around. And thank you all for coming. And for those of you who joined online, thank you for joining us as well.
The Nobel Peace Prize winning World Food Program.
That's right.
You got to add that in. I mean, it's like you earned that. So way to go.
Thank you, Thomas.